My name is Itai Matumbike. I am a consultant forensic psychiatrist. I'm also the executive medical director at Northamptonshire Healthcare NHS Foundation Trust.
Well, thank you very much for joining us here on the show. And we have got quite a few questions that members of the community have asked us to ask somebody just like yourself in the profession to answer, all to do with COVID-19 and the vaccine. Are you okay to answer some of these questions for us, please?
Oh, yes, I am. Yes.
Okay. First question up that came through, it says, do I need it?
Yes. So the COVID vaccination is probably one of the most important tools that we have to fight against this virus. As you know, it has taken more than 2 million lives globally. And having a vaccination, and a vaccination is a medication that helps you to fight off an infection before you actually get infected by that infection. So you build up antibodies after you've had the vaccination, and when you do encounter that infection, your body will have a much stronger immune response to help you fight it off. So for it will offer you protection from the COVID virus, and I would highly recommend that everyone has the vaccine.
Thank you. You recommend that everyone has the vaccine. How more important is that for people from African, Asian, Caribbean, ethnic minority backgrounds?
So we know from the studies that were carried out in the first wave of COVID that people from Black, Asian, and ethnic minority background are particularly susceptible to getting COVID, and they also have much more poor outcomes once they've been, infected with COVID. The data shows us that they were twice as likely to die of COVID if infected compared to their Caucasian counterparts. So for me, I think it is particularly important for people of the BAME background to have the vaccine for that reason. I think it's important for us, both nationally and across the world, to build up levels of immunity that will stop the virus from spreading.
The next question, will I be really ill? And I think this coincides with not just people who are healthy, but people who are also on other types of medication.
No, you will suffer some side effects, and I will explain what these are. So when you have the vaccination, it's usually in your shoulder, and it's an injection, and it's injected into your muscle, and for a couple of days, you might feel pain on the injection site. And this pain, I've had the vaccine myself, by the way, so I'm talking from personal experience. So this pain is a mild ache. It may make your shoulder feel a little bit heavy, and it usually just goes away without you needing to take any analgesics for it. So for me, I wouldn't class that as being ill or really ill as such, just suffering some mild side effects, which are very common from having that vaccination.
Okay, if I'm someone who's has to take other tablets or other medicines for diabetes, dementia, high blood pressure, all these other things that we see in some of the BME communities or the BAME communities, should I say, should I be worried about taking this vaccine alongside what I'm already taking?
So the first thing I would say is that if you're on any medication and you've got any conditions, before you have the vaccine, please consult your GP. Your GP has got all your medical history and will know, all the conditions that that may need you to be cautious before actually having the vaccine. The vaccinators themselves will ask you a list of questions about your medical history, will ask you a list of questions about your allergies, and then they will be able to make a decision with you about whether you're eligible to have the vaccine. Commonly, people who are on drugs which it can affect their immune system, may have what's called a caution. It's not a contraindication. It doesn't mean that it's absolutely not appropriate for them to have the vaccine, but it is a caution, and that's what the patient information leaflet tends to advise. Some people who have got severe allergies, and when I say severe allergies, I'm talking about if you've had what's called an anaphylactic reaction, which is a severe form of allergic reaction where you run short of breath, etc. It's advisable, that you declare that, and some types of are not advisable for people who have had anaphylactic reactions. So, for instance, the Pfizer vaccine is not advised for people who've had an anaphylactic reaction, and usually the vaccinators would prefer that you have the Oxford vaccine instead.
And that kind of leads really nicely onto my next question about how effective will it be? So this is the question that's been posed. Will it be effective? And you mentioned 2 of the possible 4 that are currently out there now.
Yes. So the MHRA, which is the regulatory authority for all medications and healthcare products in the United Kingdom, has approved 3 types of vaccines so far. One is the Pfizer vaccine, the other one is the Oxford vaccine, and the third one is the Moderna vaccine. The first 2 that I've mentioned are already available and have already been widely used. Across the country, about 8.2 million people have already received the vaccine. And those are the 2 vaccines which are currently being used. In terms of their effectiveness, and they call that vaccine efficacy, both vaccines have got very, very good odds after you've had both doses of the vaccine. So, for instance, with the Pfizer vaccine, it will offer you up to 95% protection about 14 days after your second dose. And for the Oxford vaccine, it will offer you up to 90% protection after you've taken your second dose.
Both Oxford and Pfizer have given specific times as to when a person should have the second jab. If people are not having that second jab in that time, is there any danger?
So the first thing I would say is that the Joint Committee of Immunization and Vaccination has looked at this very closely. And the decision that they took, which is supported by the 4 chief medical officers of the United Kingdom, is that it's important for us to ensure that as many people across the country receive the vaccine, at least the first dose of the vaccine. So if we delay, if we give the people who've already received it the second dose, for every person who receives a second dose, it's another person who has not received the vaccine that's deprived of that slot. If we look at the data that informs that decision, so for instance, the Pfizer vaccine, after your first dose, you will get up to 89% protection, and after your with the first dose of the Oxford vaccine, you get up to 74% protection. So from where I'm sitting, those are pretty good odds in terms of that. I think it's important for us to say that it's not, it's not a standard that if you have received the first dose, you will not receive the second dose of the vaccine. You will definitely be able to get the second dose. But I think it's an argument about is it in the public interest, or is it a good public health decision to make to allow only a small section of the population to receive both doses of the vaccine, while another large part of the population do not receive it. In fact, what you see in terms of the spread of a virus such as COVID is that the more numbers of people who have got a degree of immunity, the more likely the virus is to be stopped from spreading. So that's it's in the interest of all of us to have as many people vaccinated, at least with the first dose, as possible.
Next question. I've had COVID. Do I still need a vaccine?
Yes, I think it would be in your interest. Usually, if you've had COVID, what we would recommend is that you wait for 4 weeks after you've recovered before you have a vaccine. So if I can just explain, what the benefit of having a vaccine is. So the vaccine will produce what is called the spike protein, and the spike protein is a surface protein which is on the virus itself, and it's that spike protein which allows the virus to get into your human body cells and cause you to become unwell. Now, when you produce the spike protein from the vaccine, the body then starts to build up antibodies to a spike protein. Remember, the vaccine that you get, it's not a whole virus, and it's not an infected form of a virus. It's actually just a component, which is the surface protein. And it's the surface protein or the spike protein acts as some kind of ID for the virus. So when your body has built up all those antibodies, when it does get infected by the real virus, it will recognize that spike protein, and it will launch a really robust immune response and stop you from getting sick, and stop you, certainly as the evidence shows, from suffering the more fatal forms of the illness. So if you've got some circulating antibodies and then you have the vaccine, it acts as a booster for your immune system. So your degree of protection is enhanced. So even if you've had COVID and you've got some antibodies circulating within your bloodstream, when you have the vaccine, you actually build up more antibodies, and it enables you, if you are exposed to the virus again, to launch an even stronger immune response and eliminate the infection from your system.
Mm-hmm. Thank you. Another question: what is long-term COVID?
So long-term COVID is a phenomenon that we've seen from the first wave, and it's when people suffer from what we would call sort of the after effects of having an initial acute COVID infection, and that affects their ability to breathe and some of their general body malaise. And it's important for us to be, mindful of people who've had COVID and follow them up in order for them to receive treatment for long COVID. It doesn't happen in everyone who's had it, but it is, something which is of concern to us, and hence why if people have a vaccine and do not suffer the serious forms of COVID, there is an even less chance of people suffering from long COVID. Can be quite disabling for the people who have suffered from it.
If I have sickle cell, which vaccine is best for me?
So, like I said before, the best person to offer the right advice in terms of a vaccination is usually your general practitioner, because they will know what medication you're on. So some people who've got sickle cell anemia may be on medications which suppress their immune system. And in those particular instances, vaccination is a caution, and it's important for them. So without knowing what exactly the person's being treated with in terms of what medication they're on, it will be very difficult for me, and it wouldn't be advisable for me to be offering any medical advice. I would say that the first port of call would be your general practitioner. Have a discussion, because your general practitioner will know, the extent of your immunosuppression, and will be able to advise you accordingly about which vaccine. Both vaccines which are currently available come with a caution around immunosuppression anyways. And there is, a very useful resource on gov.uk, which people can access patient information leaflets, and use that to inform some of the discussions that they might have with their general practitioners.
A question that came to my mind was that we seem to be producing these vaccine factories across the country. There's one definitely in Moulton Park in Northampton. How equipped will be the people there giving out the vaccines? Could it be dangerous as in going there and getting the vaccine if they haven't got all your medical records, or will there be safety measures in place?
Yeah. So, for when you go to, the term that you use, vaccine factory, threw me a little bit. Presumably you mean, vaccination centers, where people actually go to receive the vaccine. Whenever you go to a vaccination center, what will happen is that you will have a trained, a prescriber or vaccinator who will ask you a series of questions. So I can reflect on what happened when I actually went to have my vaccine. So I sat in a room, with a prescriber who went through a list of questions, asked me all about the allergies. There will be a doctor available at the vaccination center. So if, having gone through all of those things in the questionnaire, there is something of concern, there will be a query raised to the doctor who is present at the vaccination center, who will then be able to give advice on what to do in that respect. So when you go there, my advice is that carry your a form of ID with you. Also carry your NHS number, so that it will be easy for us to be able to record the right information and etc. It's also one of the things that will always happen is that if you receive the vaccine and you've been cleared to have it, you will have to wait for about 15 minutes whilst you're at the vaccination center, just in case you develop any allergic reaction. There will be trained staff who will be able to attend to you very, very quickly. Yeah, that's true, because the medications for some of these conditions vary. Some of those conditions will have, some of the treatment will have what are called immunosuppressive effects, which means that the treatment itself weakens your immune system. So you do need to consult your GP, and you do need to speak about it with the vaccinator. They're not, if I can just reassure members of the public, it's not to say that if you've got any form of immunosuppression, or if you're on medication which causes immunosuppression, that you can't have the vaccine. It's just a caution. It just enables us to be able to kind of track you and make sure that you're all right. So I think that's the important point to make there, and that's why the default position is for you to consult your GP, who will know your medical history well and be able to advise you accordingly.
Thank you. And I was just going to say, really, that is the most of the questions that we have that have been sent in from the communities here. A lot of them are from the BAME communities in Northamptonshire, and yet still, even though they watch the TV, they watch the news, we are finding that we still have members in our communities, especially the elder ones, who are still sitting on the fence, being reluctant to have this vaccine or vaccines. What would you say to them, Doctor?
So for me, I very much believe, being someone who's of a BAME background myself, and I interact with a lot of colleagues and members of the family, just members of the general community, members in the church. People have got concerns based on some of the social media information that's been circulating, some of which is not substantiated by factual information. But I think that people will have been influenced by that. And I think it's right to be worried about your own health and your own safety. And I think it's important for people, not to feel, blamed for having concerns. I think it's important for people, in positions like myself, to be able to listen to those and, offer, the right information that will allow someone to make an informed decision about vaccination. I think it remains your choice. What I would say is that when I made the choice to have the vaccine, I was thinking about my own health. I was thinking about my own family. I was thinking about my friends. I was thinking about the patients who I treat and people who I come into contact. And it was about protecting not just me, but just the wider community and stopping, this really devastating condition that's taken so many lives. In order for us to be able to stop the spread of COVID, a certain percentage of the population, between 50 and 90% needs to have been vaccinated. So it's important for us, to get that number as high as possible because that will reduce the spread and it will protect us all. COVID has, devastated particularly, the BAME community. Like I said before, the outcomes were really bad in that group of people, and it really shone a light on pre-existing health inequalities. And it's important for us to work together to stop the spread of this deadly virus. It's important for us to think about the information that we have access to try and get access to the right information. The www.gov.uk website is a really good source of information. And I think there's also scope for us to have more community engagement where people are asking questions. So much in the same way that this interview has been conducted, you collated a number of questions from your listeners, things which they were concerned about, things which they wanted answering. And when you have that two-way dialogue, I think you stand a better chance of actually being able to persuade people to make the right choices about their health.
And finally, Doctor, this is, are BAME elders and members of the community being prioritised due to known vulnerability to COVID?
So if we're looking at the local community in Northamptonshire, Yeah, I'm pleased to report that our ability to access the older members of the population has been really good. So far, we've managed to vaccinate 87% of the over 80s, which is an admirable feat in itself. And remember what I said to you, that a certain percentage of the population needs to be vaccinated. If we can see that level of uptake of the vaccine, across all age groups, we stand a really good chance of protecting ourselves, from this virus. We at the moment do not have, the exact figures of, what percentage of the over 80s were from a BAME background. So I wouldn't want to, just speak about something which I don't have factual information about. However, what does give me quite a lot of, reassurance is the percentage of the over 80s within Northamptonshire that have been vaccinated. I'm really grateful to all the staff who've, had a collective effort in this. A lot of hard work has gone into, arranging for people to be booked in to have the vaccine. The opening of vaccination hubs at KGH and NGH has really helped. And also, when we've opened up, the community, vaccination hubs as well, that's allowed us to have a much wider reach and vaccinate as many people as possible. So I'm quite quite reassured by the figures that we've got so far, and it's also looking at people who have got what are called clinically extreme vulnerabilities. So a number of the people who are from a BAME background are likely to fall in that category. So you spoke earlier about people with diabetes and hypertension and some other long-term conditions. You'll find, due to the health inequalities that exist in the community, a lot of our BAME members of the public will have those conditions and will by default be regarded as being clinically extremely vulnerable. And it's those clinically extremely vulnerable members of the population who are actually being prioritized for vaccination. It's a bit of a long-winded answer to your question there, but yes, we are prioritizing BAME members of the public.
Mm-hmm. And the reason why I said that, we had a particular case study that was sent to us by a family in Northampton. Their mother is 87, she's paraplegic, and she has 4 carers that come to her home. They've been trying tirelessly to get their mum the vaccine, and they've not been able to get it for whatever reason. They're very worried about their mother, where her mum lives, and where their mum lives. There are quite a few houses, they reckon, and they decided to knock on the door. Out of 100 houses on the street, out of the 100 houses on the street, only 5 had not had the jab. Of the 5 people, 4 were black, and none of these 4 had yet received a call to get themselves a jab. So you can imagine what this family is going through at the moment. They kind of did their own bit of research, and they want to know, is there a way they can get their mother to have the vaccine jab? Is this just a one-off situation that they're feeling, or in their words, is there an underlying issue here?
That sounds really tragic, and my thoughts are with that family who's experiencing that level of distress. It is quite distressing to be going through something like that. It's very difficult for me to comment without all of the facts but what I can do is uh, investigate this particular situation and find out what the blockers are, and get in touch with the clinicians involved and ensure that their mother is vaccinated without delay. If you are over 18, you fall within the first priority group of people to be vaccinated. So it's important for us to look into that with all the facts, and if it is possible for you to obviously off air share the details of these people, I will be sure to contact them and contact the clinicians who are involved in their care and raise this concern. My view as a clinician, my view as a medical director who's working within the Northamptonshire care system, is that we need to protect all those who are most vulnerable. I know that colleagues across the system are working tirelessly to ensure that we reach as many people as possible who are vulnerable in terms of the clinical conditions that they have. And I think this sounds very much like a case that slipped through the net, but does require us to act with agility to try and resolve the issues there.
Yeah, I will definitely pass on those details to you, or indeed get the family to give you a call if that's okay, because I think that's why they turn to us at the end of the day. I mean, we're a community radio station that does speak to a lot of the BAME communities, and I think when the listeners turn to us for help and put questions like that, there's probably just no way I could have done this interview without asking a question, and I really appreciate your answer and your response.
Yeah, and to be honest with you, under these circumstances, it's a very it's an unprecedented vaccination effort, and it's an unprecedented pandemic. As NHS workers, we don't always get everything right. And sometimes it's important for members of the public to point out where there are lessons to be learned and things that we can improve on. And a part of restoring that public confidence is to act with agility to resolve issues when they are raised to us.
Thank you very much for your time and your expertise and your willingness to get the right message out there into the community so people can make their own choices. I hope we can speak to you again in the future. I will be passing on those contact details, sir. But I'm hoping that we can speak to you again in the future. And of course, as members of the community that care about each other, that we can help with your skills, with our connections to the community and the listeners and their ears. Hopefully we can, save lives and indeed, rid the world of this horrible virus, which has caused so much pain and suffering.
Yes, indeed. I would be very keen to avail myself whenever you make that call, so that we can work together here, with you working in the community with us, trying to improve the general health of our community, as healthcare staff, and I think us working collaboratively is key to this, and where people have got concerns, they shouldn't feel blamed, they shouldn't feel targeted. They should, feel reassured when we listen to the concerns that they have, and offer them the information that they are asking for.
Thank you very much, Doctor.